Thank you very much. This is just a little story to set the pace, the context for the technical connectathon, which is going to happen immediately after this session. So, but we have a few panelists that we just want to share their experience about this patient journey before we go into the connectathon. Let me especially introduce and invite Dr. Teresa Kaitenwachukwu, who is a global health workforce coordinator, a leadership coach, and a communication leader in the health sector. I think we just heard her voice now. She has a medical and public health degrees from the University of Lagos and Ahmadu Bello University. Also has a global health certification from Tulane University and is a Hobart Humphrey Fellow of that same School Public of Health and Tropical Medicine in New Orleans in the US. She's currently the state epidemiologist at the FCT Health Services and Environment Secretariat. Dr. Teresa, we're happy to have you. We also have a senior consultant and back-end engineer at Modus Creates. He's a fire engineer. We've talked about fire since morning. This is someone who has decades of hands-on experience in complete software development cycle, from analysis and design to testing and implementation, with expertise spanning across webs, mobile, serverless, and microservice architecture. He has achieved quite a lot, including building standard-based consumer-controlled health data convergence hub that seamlessly and securely connects patients, providers, and payers. Let me welcome Olumide Oduola to the podium. Let's appreciate him. And lastly, but not the least, we have Professor Christy Akwaiwo, who is joining us online. She's a consultant public health physician, an associate professor of global health in the University of Uyo, and currently the deputy chief medical advisory, deputy chairman medical advisory committee for the hospital, and also director of the research and training in the University of Uyo Teaching Hospital and the Institute of Health Research and Development. Professor Christie is a graduate of the University of Calabar and the London School of Economics and London School of Hygiene and Tropical Medicine. She's a fellow of the National Postgraduate Medical College of Nigeria, as well as a Kofi Annan Global Public Health Leadership Fellow. She's a health system strengthening expert and advocate for universal health coverage and digitization of health systems. Professor Christie, we welcome you to this panel.
Thank you. Thank you.
So I'll start with Dr. Teresa. I think this is a very pathetic story. You know, we're only happy that it's a hypothetical story, but I'm sure quite more pathetic stories like this are happening all around the country, where people, you know, like because of lack of access to health records, they end up having lifelong, you know, situations that they need rehabilitation all through. So, Dr. Teresa, what are your personal experiences, both in practice and your current role at the Public Health Department of the FCT Health Services Secretariat?
Thank you very much. There's another microphone there. Thank you very much, Ini. I think it's a story that if you're working in the health system, you can relate with. When patients come in critically ill, maybe unconscious, one of the things you have to do as a clinician is to take a past medical history. And if the people who bring the patient do not have access to that past medical history, it can be practically impossible for the attending physician to have access to that history. There's really no way for you to log into and get information about that patient. And that's why sometimes patients get given medications that they are allergic to, that they should not take. In Amina's case, we saw that she has allergies to sulfonamides, one of the very common drugs that we give. If you don't have access to that information, you could make that diagnostic mistake or that prescriptive mistake. So yes, in my experience, I've been hampered in my clinical care when I had no access to a patient's prior medical history, past surgical history. But now as a public health physician practicing fully in the public health sector, we see this happen even more clearly. Just yesterday, we had a meeting. We have the STASOM meeting, which is the State Surveillance Outbreak Review meeting for the FCT. And one of the cases we reviewed was a case of rabies of a young boy who had been bitten by a dog 2 months previously, somewhere in Osun State. Came to the FCT to visit the father and then started having symptoms. Now, when the doctors at the health facilities heard about this history, they had no way to find out what had been done from Osun State. There was no way to go into the records and find out, had he been vaccinated? Had the dog been vaccinated? How did the dog die? There was absolutely no connection between what had happened in Osun State and what happened in the FCT. So the outcome for that patient was very poor. We lost that patient. But the idea is that there should be easy access to a patient's record. It doesn't matter where that patient was seen. So we're really, really excited at this developing conversation about interoperability so that one system, the system is made seamless, and every healthcare practitioner, whether you're in public health or you're in clinical service, you should have access to patient's record every time you need them. Thank you very much.
Thank you, Dr. Teresa. Professor Christie, you know, in your years of practice, you know, like Dr. Teresa said, this is a very common story in our practice. You know, Professor Christie, how frustrating is it, you know, for a physician who wants to track? Can you hear me, Prof?
Yes, I can.
Okay. How frustrating do you feel in your years of practice around tracking patients over a period of time in terms of, and sometimes losing them to follow up? I mean, you see patients, you need them to come, you know, you see them when they are probably having fever, and then you don't find them, they don't come for follow-up, and then you're seeing them when they are unconscious over time. Probably they've gone to several places, including TBS, roadside pharmacies. How frustrating does it feel to you as a practitioner? And what specific experience and, you know, mitigation do you have in your own case setting regarding this?
Okay, so it's extremely frustrating for patients, for the physician who has to manage a patient. The first thing is that our system is quite complex, right? Our system is pluralistic. Our traditional birth attendants are there, the unorthodox system is there, and then the orthodox system is there. And then this patient that you're seeing has traversed, probably gone through all of those places. And now that patient has, you know, a history, as Dr. Teresa has pointed out, documented somewhere, is with somebody somewhere. And then every time this patient comes to a physician, it's like the patient is seen afresh. You have to start taking a full history. You have to, you know, get to ask questions again. What are your allergies? What are the things we need to, you know? And all of this can be quite frustrating because you know that it's already there. And then imagine like in Amina's case, imagine the patient is unconscious. Nobody to tell you that history. Nobody to tell you what drugs the patient is on currently, what the patient ate in the morning, nothing. So it's extremely frustrating. And that is why it is very, I mean, it's a good thing that we are talking about systems that are seeing each other. And the issue of tracking a patient that's lost to follow up, it can be extremely frustrating. Since our systems are not speaking to themselves or seeing each other, we find out that you have to physically get the patient's phone number and try to find the patient. That is if the patient has a phone number. So for some patients, there's no phone number, they give you an address, and you know how our address systems are. They house next to the apostolic church that is close to the big gutter, and then they start to track that patient. So it's almost impossible to track such patients.
Thank you very much, Prof. Olumide, I know you're not a medical practitioner, but I mean, you have a diploma in medicine awarded by me from your work in integrating healthcare, digital healthcare platforms. Yeah, I wanted to ask you, I mean, in the past, and even in some places now in Nigeria and some parts of the world, you have patients being seen on notebooks, exercise books, right? They are registered each time they go to the hospital. They are documented, their history, the date, the symptoms they presented today, their diagnosis, the drugs that were given. And these patients they take these notebooks home. And then tomorrow, if they happen to find themselves in another health facility, they can easily present that notebook and the doctor can see, oh, this is the patient's history. With this happening, even with the manual system, do you think it's justifiable for us to be talking about digital systems where when there's access to patient record in the notebooks and doctors also have that access when those notebooks are presented, irrespective of whichever healthcare setting they are? How do you, in your work as a fire engineer, how do you justify, the government's expenditure on digitizing systems, and then with the increasing adoption of digital systems by different, vendors, how do you rationalize? How do you justify that as against this paper system that we have presently?
Yeah, thank you very much. First, I'm going to say we should all understand at this point that the world is turning to a global village, right? And everything is becoming smart. So traditionally, we have documents in notebooks, right? And we can carry that, anywhere we want to travel to, but it's not effective, right? Anything can happen to it. It can get lost. I even personally lost my birth certificate. I had to go and do an affidavit to actually, declaration of age, so I can have one. So in such case, it's bound to get lost, or the material is going to be degraded with time, right? And anything can happen to it. So that's why we encourage making this kind of data available in digital form, right? It applies to every aspect of our lives beyond the healthcare. So the healthcare shouldn't, lag behind when it comes to things like this. The fintech industry is way ahead, right? And we're trying to bring the healthcare to do the same. And in terms of justifying it, we've seen a user journey of Hamina right here, which really is a sad story. And no matter how fictitious you think it is, it happens every day. And we don't, for instance, the kind of application I worked on a couple of years ago is to avoid such a case, whereby you can carry your healthcare data as a patient everywhere you go. And even in a situation where, you become unconscious, you can't predict certain things, right? It's life. The health practitioner, even the people around you, can pick up your digital device, and, get your, even if they can't access it, get your emergency content, and they should be able to just get your details. Then we can easily pull your healthcare record and have access to your health application, right? And even this, we're trying to unify it in such a way that, you know, it's easy to have an history of your, so it's not at the point where you know, they need it, they get it. It's already integrated across, right? Whether it's centralized or decentralized, you're going to find out we aggregate it. So I think it's justifiable to preserve lives, right? In that manner. And it's quite important we have it in digital form to make it portable, and we can have it everywhere. Thank you.
Thank you very much, Lumide. And I think this will just be like the last question for each of the panelists. Now you see yourself as a patient, because we may be doctors, we may be engineers, but I think we get ill at some point. We are all patients, right? So for you as a patient, you know, what are your fears? What are your feelings? What are your ideas? And what are your expectations around this access to your personal record across these different healthcare settings? Do you have fears? Do you have ideas around it? Do you have expectations? Just 1 minute, please. Dr. Teresa.
Thank you very much. So a few weeks ago, I was really very ill and I ended up in a Socorro hospital. And then, first of all, it was the fact that before they knew I was a doctor, a doctor would come, take a full history. Oh, then they find out that I'm a doctor, and then they take their notes and then they go. And then we move into another doctor who comes and then begins to take the whole history again. And I kept saying, there should be a system where you just go in and see all the information I have just given. And so even within that system, I found that each physician that would come would start asking me the same question. It becomes very frustrating for me as a patient who was unwell, who just wanted to go to bed and sleep and rest. So that is one thing with the patient. It will just make life very easy for the patient if you just go in there. But I think the other fear I would have as a patient is inability for someone else to see this history for me. If I'm unable to give that information, if I'm unconscious, that people will have no access to my information. So for me, that's a concern. And then of course, the issue of privacy. So I don't want everybody having access to my history except those who really need to know. So I would want to know, for those of you who are into developing the intelligence for this, I would just want to know that you're taking all of this into consideration. Thank you.
Thank you very much, Prof. 1 minute.
Okay, so Teresa has expressed much of my fears too. Privacy. I'm worried about my data, my information not being safe. But for expectations, I really want to have my information, my health information digitalized. But I don't want that cost to fall on me as a patient. Yes, I don't want that cost to fall on me. I think it is possible for our policymakers, for the government, to make the system seamless. And yet, I don't have to bear that cost. Thank you.
Okay, Olumide, finally, in the voice of Dr. Teresa and Professor Christie, you have heard the fears, ideas, feelings, and expectations of a doctor, a patient, right? And policymakers. After now, we're going to the technical event. In terms of what we're going to do, the connectathon itself, can you tell us, in the room, what sort of things we're going to do in respect of these fears and expectations being expressed? Thank you.
Yeah, thank you. And I'm going to modify that to address engineers, right? We're going into the technical sessions, both web developers, software engineers, cloud engineers. I think the most important thing is to listen, to your patients, right? We heard them. We've heard their fears as well. And one of those things is, as an engineer, I know we're always excited to write code, and we find this new fire technology, and we just want to jump right into it, right? And what I'm going to say is we need to take a step backward, right? And understand these guidelines, policies, they are there already. And such as the SMART guidelines from WHO and even from the Ministry of Health. And to help us understand the problem, right, we want to solve. We know we have one. And in terms of privacy, there are actually things we have in place. Like me, myself, I've taken some EPA certifications just to help you understand what kind of data you need to access and what you need to do with it, right? And how you need to access it. So it's important for engineers to take that step backward, understand the problem. And, it's not just about the technology here, right? It's beyond that. And I think once we understand this, we'll be able to provide a better solution in the long run in terms of security, usability, user experience, and everything that comes with, using the application as a whole and making sure we're actually giving the right value back to the community.
Thank you very much. I think this is a good point to stop. As I appreciate our panelists, please let's appreciate them as they return back to their seat. Over to you, Juliet.
Thank you very much. We have gotten through a lot of content in such a short time. I really want to appreciate everyone's patience for us going through all of this. Thanks to all the panelists for all of the technical sessions. And I